Good evening, everyone, and thank you for joining the Lancaster NAACP and Streamline through the Cultured Professional TCP for this very important town hall focusing on COVID-19. We'll continue hosting this series to provide information, education, and resources on this deadly global pandemic that disproportionately affects people of color, the elderly, and other marginalized communities. We need to keep our defenses against COVID-19 pandemic. Masking, physical distancing, and vaccination will be a part of daily life in 2021. Health education is a critical aspect of disease and mitigation. Increased information leads to good decision-making when it comes to avoiding the coronavirus. NAACP Lancaster, Penn Medicine, Lancaster General Health, empowered by TCP, the Cultured Professional, are collaborating to present a virtual town hall this evening. The event is a part of the series entitled COVID-19 Crisis. Tonight, you will hear directly from health experts who live and work in our community. Tonight's event will be moderated by Marquis Lupton, CEO and co-founder of TCP, a multimedia digital platform designed for marginalized groups in central Pennsylvania. Our panelists today are Dr. Jeffrey Martin and Dr. Cherise Hamblin, both of LGH Health. Dr. Martin chairs the LG Health Department of Family and Community Medicine and sees patients of all ages, from newborns to older adults. Dr. Hamblin practices an obstetrician and gynecologist as a part of the LG Health Family and Maternity Medicine practice. She has also joined with colleagues to found Patients Are Waiting, an organization committed to increasing the pipeline of minority clinicians and supporting them in their work. The NAACP Lancaster shares a vision of the national NAACP organization to ensure a society in which all individuals have equal rights without discrimination based on race. The NAACP focuses strategy for the 21st century on 6 game changers: economic sustainability, free and high quality public education for all, health equality, including high quality health care, the equitable dispensation of justice, protected voting rights, and fair representation for all, and expanded youth and young adult engagement with all these issues. With that being said, I will be transitioning this to our moderator this evening, Mr. Marquis Lupton. Thank you everyone for joining us, and we hope that you get the education and you are informed about the vaccination, as well as other things related to COVID-19, and we thank you for being with us.
Here we go. Awesome. Thank you for that, Blandon. Appreciate that. Ladies and gentlemen, thank you for joining us, and welcome to another evening of discussion, circling around COVID, circling around Lancaster County, circling around our overall mental health and what we should be doing and how we should be feeling at this time. Last discussion, we got into a couple key details, and we're going to continue that tonight. Dr. Hamblin, if I can begin with you to kick off our conversation for today. COVID vaccination. Any updates? Anything that we should know about? Again, much like last time, there's a bunch of information out there. So coming from a professional's mouth, what should we be paying attention to, and so forth?
Well, thank you so much, Marquis. I will answer, but I am just so appreciative of this platform and this discussion that's been being fostered and continued. I attended, I think it was the last 2, one where Dr. Yasmin Charles was talking about the vaccination, and that was really informative, and Dr. Livingston also had participated in another one in the past. And so I'm really appreciative to be here as an OBGYN. I take care of women. I'm not on the front lines of the COVID pandemic. I certainly have had some, patients with COVID, ordering testing, and we've all as a healthcare community have been facing this in one way or another. Vaccination is now available at LGH and throughout the country, and we've seen pictures and videos showing everyone, some places have had pretty interesting campaigns like not going to waste my shot, sign up and whatnot. All of us have had our lives derailed by this worldwide pandemic. As a Black woman physician, I feel like I'm standing between two places where you hear about the terrible outcomes and the disproportionate effects in communities of color, that overexposure, decreased protection, whether it's being more essential workers, access issues, so many things that this pandemic has just brought to the forefront of the general public consciousness. Some of the things that we've all known and experienced and been talking about or thinking about or dealing with in our own ways. For me, yes, the vaccine is available right now. Healthcare workers are being vaccinated. We know that we've been waiting all this time for two things: effective treatment, prevention. Effective treatments, there are some changes, monoclonal antibodies, been some advancements in treatments, but it is still can be lethal, and it's killing people in a way that's not predictable. And then if you have pre-existing conditions, much more likely. Since the last town hall meeting, I've had two personal developments. One, receiving my first dose of the vaccine, which I'll get my second dose tomorrow. And two, losing another dear friend to COVID, who's 2 years older than me. And so this is personal. It is part of my professional life, and I'm affected just like everybody else.
Thank you for that. Dr. Martin, we want to get you in here as well. Thank you for joining us. Same question to you. Updates on the vaccine, a whole bunch of information out there, anything that we should or should not know, or should not be paying attention to at this moment in time.
Well, Marquis, thank you very much for having me. I appreciate it, and it's my pleasure to be talking along with my good friend, Dr. Hamblin. I think the most important thing that I would want to say about the vaccine is that this is really the beginning of the end of the COVID pandemic. But it can only become the end of the pandemic if we get people vaccinated at rates that are above 60 to 70% in the general population, so that we can get enough immunity out there so that we stop the spread of COVID. Like Cherise, I've had personal experience with people that have had COVID. Fortunately, nobody that I know has passed away, at least not in our family, but certainly close family friends have. Our family has been disrupted. I have two children that are in college. One did have COVID. The other was deathly afraid every day that she was going to get it. Thankfully, they're both doing well. And I know it seems a little confusing about the different messages around vaccine. I think there's confusion about how it came out, how it was approved, is it safe, what are the side effects? And I'm happy to answer any of those questions, but right now I would say, and I did get my COVID shot, I feel fine. I would encourage people that if you get an invitation to get the COVID vaccination, that you sign up and get it as soon as you can. I think we don't have time to sit back and to think about it, to wait, to give time to waiting as COVID rampages across our communities. So I think that would be the biggest message I would have. But I do understand people's hesitancy, and I'd be more than happy to talk about some of the issues related to that.
Yeah, so jumping into, the vaccine, as I said, I stand between two places. Like, yes, I'm a physician, I'm also Black in America. And so my experience is different than some other people's experience. My point of reference is different as well. And this is one of those places where I could hear the briefings at work and the vaccine is coming out, it's an mRNA vaccine. And so back in last year, I want to say it was January, and Jeff fact check me or change, feel free to interject as I talk, because I like to talk. So last year when the COVID-19 virus was sequenced, instead of one company or organization holding on to it, it was like the sequence was sent out to say, hey, we all need to work on this. Doesn't matter who wins, everybody try. So here's the sequence and start working on your version of the vaccine. So there were many companies and organizations that then went to work on creating their versions of vaccines. And for a vaccine to be approved, it has it has 3 phases. So first you have to say, hey, is it effective? Is it safe? And then roll it out. And so where we are now, we're in phase 3 with more like widespread people getting it. And everyone who's receiving the vaccine now can also comment and basically report symptoms. There's a website called vSafe by the CDC to report any symptoms. You'll see things that are reported. It's like, I had my second dose and I've had fevers, I've had chills and all of these things. Well, let's think about what happens when our kids get their MMR vaccine or any of these vaccines that are in series. The first shot, they may not feel anything much. The second one, they mount more of an immune response because they're seeing it again. And that's kind of how you know that it's working. And so you have your kids to take Tylenol or ibuprofen to just manage those symptoms. You expect them to feel maybe a little bit lethargic for a day or two. And you just rest and hydration. And that's what we do for kids. And it's interesting. And I think that we should think about that and do more talking about that for COVID vaccination as well. Like these are expected, expected things, arm soreness, maybe some fatigue, a mild fever, even after the second dose. So the mRNA vaccine, the sequence was given out to everyone, and multiple pharma companies went to work on putting together a vaccine. While they went to work on putting it together in phase 1, some also went into production of it, saying, hey, I don't even know if this is going to work, but we're going to try and start to get into production because we're going to have to vaccinate so many millions of people in order to get beyond this pandemic. And so some of the things that normally happen, why it takes years to develop a vaccine, were bypassed here in the interest of the public good, in the interest of not having, not losing more lives, but not anything to bypass safety. So Jeff, do you want to fill in any blanks?
Yeah, because I have to say I was concerned too as a provider because it takes a long time normally to get vaccines out to market. I mean, we're talking half a decade to decades usually. And I think the way Dr. Hamblin laid it out is really important to note that what the federal government did was basically level the playing field and take away risk to the different pharmaceutical companies for manufacturing a vaccine that they may or may not have been able to bring to market. So normally pharmaceutical companies would have taken a very slow plodding course, making sure that everything was correct, that that there wouldn't be any sort of surprises at the end, because you can't put in billions of dollars not to have the return of your investment. And what happened was the federal government essentially took that risk away from the pharmaceutical companies. So they could just innovate as quickly as they could, start even production before they had the phase 3 safety data trials in hand. And so that's really how these vaccines have gotten to market. The evidence and the trials and the safety piece was not shortened really in any way. That normally would have taken the amount of time that it took for a regular vaccine. So I feel very comfortable with the safety of the vaccine. They did, at least with the Pfizer vaccine, use a broad-based population. And interestingly, those that identified as African American in that clinical trial, 100% were protected. They had the highest protection. I mean, the overall protection was 95%, but among the African American community, it was actually 100% in the clinical trial, and that was with 3,000 participants. So So it was well represented from a lot of different groups, from different countries, different ethnic and racial backgrounds. And so I do feel comfortable taking it myself and advocating for my patients.
One of the things I think is just so interesting, it's like when you take out the money of the equation, all of a sudden we can get things done very quickly. And that's, to me, that's really telling, right? Because we live in a capitalist world, all of that, yes. And people are concerned about the bottom line. And it's almost like this process is like a little bit of utopian society. Like if we didn't have to worry about costs, if companies weren't worried about, am I going to make my profit, they could actually just put together what's going to help people, what's going to get us out of this pandemic and out of this lockdown and out of this derailment of our lives. So those are some of the things to me that I think are really great. The other piece about the recruitment, and we've seen and heard, for anyone who wasn't aware of a historically Black college or university in the past, they're now aware of it because of many gifts that have been given to HBCUs. Some of the HBCUs have been very vocal about participating in the vaccine studies, participating in clinical trials around COVID, and it's not for nothing, because we can see having 10% of the study participants in the vaccine trials, the African American. I mean, when you look at cancer trials, and we'll have a cervical cancer health disparities talk coming up on January 23rd, shameless plug. We can look at cancer trials and not have 10% of the participants be African American. It's, oh, the problems in recruiting and so many things. But when we actually look at it, if Black people are offered to be part of studies, we actually do participate. And when we participate, we can be involved in advancing science and in getting cutting edge therapies. So we've been affected, and now we have an opportunity to hopefully widely accept the vaccine. And society, it's rolling out based on risk categories. So right now it's healthcare workers, high risk healthcare workers. And so then you'll see as the weeks and months go on, and there's even been some really interesting discussion about just how can we make this even faster. And so I think that this is another opportunity in our community to partner with the health systems and getting vaccine widely available. We're all able to be at risk, and some of us more at risk from the jobs that we do, whether it's from being teachers, postal workers, servers, et cetera. Let's make sure that those folks, have the increased access to the vaccination as well.
All right, thank you for that. We have a question from Ms. Jody Richardson. She asked, is there a difference between the two vaccines that are currently being administered?
Go ahead, Jeff.
Well, so both, if that's okay, I can answer. Both the vaccines are messenger RNA vaccines, as Dr. Hamblin mentioned, and they both have similar effective rates, and we're not seeing any difference in terms of side effects more in one versus the other. The biggest difference between the two vaccines are really that the Pfizer vaccine is kind of more of a logistical problem related to it, in that it has to stay quite cold, minus 80 degrees. And there's a lot of difficulty in making sure that the vaccine stays cold until it's just ready to be used. The Moderna vaccine also has to stay cold, but it's nowhere near as low as what the Pfizer vaccine. So it's a little bit easier in terms of logistics to distribute the Moderna vaccine. But short of that, there really isn't a lot of differences between the two vaccines in terms of their effectiveness rate. Now, it's important to realize that both the vaccines, the endpoint in their studies was more whether it prevented clinical apparent COVID illness. And the secondary endpoint was whether it prevented serious illness leading to hospitalization. So what we still don't know about either vaccine is, does it prevent transmission of the virus? In other words, is it possible that somebody can get the vaccine, be immunized, and still get infected with the COVID virus, not enough to feel it or to know that they're infected, but enough to pass it on to somebody else. And that we will hopefully find out over the next 3 to 6 months as more and more people actually get the vaccine. And that's why once you get vaccinated, you still have to follow all the mitigation measures, such as wearing a mask, hand washing, staying away from folks within 6 feet for more than 15 minutes, because we don't know if the vaccine protects you from transmission. So at this point, there really, I can't give a qualified recommendation of one vaccine over the other. They both are pretty equal.
Yeah, I would also just point out, it's not like you get your vaccine and then you go through the world without a care or concern. The end point that we're as a society are trying to get to is herd immunity. It's just very similar to other things that if we don't have a critical mass of people who are vaccinated, then this virus is going to continue on. And it's not actually going to change. So for me, and looking at what happens after you get it, doesn't mean that now you can go and socialize and do things, differently. The prevention, right? And so a person can be sick with COVID and not know it and not have symptoms that are significant. They may develop symptoms a day or two after you see them. And so wearing your mask, washing your hands frequently, avoiding, touching your face with, as you touch other things. And then look at the people who live in your house. That's your bubble. I have talked to people throughout this year where they are, they're hearing this message of 6 feet and they're staying away from the people in their home. That's not the message, because isolation can be harmful as well. You don't want to feel so disconnected from the people who you love and the people who care for you that you're now having, suffering from the mental health side effects of this long whole process that's been going on. So washing your hands, wearing the mask when you're around other people, and minimizing your contacts with people who aren't in your household, especially any contact with someone who's not in your household, wearing a mask. I think that's all I wanted to say. I'm looking at the chat. Should we just go into the chat and talk about the questions?
Yeah, I was going to follow up with the next question. So if you want to go on ahead, then yeah.
Okay. There's the question in the chat about, are there any known risks to individuals undergoing living donor transplants? Should donors and or recipients wait until after that transplant to get the vaccine? Jeff, you can go, but I want to just say something. So right now, in some of the discussions I've been in, it's like, should I get it? Should I get it? And it's not available widely yet. So the rollout it's this tiered rollout. But as Jeff was saying, one of the things is to figure out, one, your primary care provider is a person in an office that you need to be in touch with. If you don't have one, you want to establish care and make sure that you're tapped in. Like, now's not the time to not to ignore your the office that's been trying to get a hold of you. For this specific question, that specific population, that sounds like someone who would need to talk with your actual provider, to get an individualized decision.
Yeah, so you're exactly right. It's a good idea to talk to your primary care physician and talk about whether or not you should get the vaccine. What's important to know is that unlike some vaccines, you cannot get COVID from this vaccine. There is no actual virus in the vaccine. It is only a small snippet of that messenger RNA, which actually degrades very quickly once the vaccine is given, and it tricks the body into making copies of the spike protein to the virus, which then your antibodies and your immune system recognize, and that's how you establish immunity. So you can't get COVID from the vaccine. So in fact, people that are undergoing transplant or who have immunosuppression, those folks really should be in a high, consider getting the vaccine earlier rather than later, because what you don't want to do is to be going down the transplant process if you're donating an organ or accepting an organ and have that changed because you developed COVID. Well, you know, because if you develop COVID, then you have to cancel your procedure, you cancel your surgery unless it's an emergency, and then you have to push it back 2-3 weeks. So in general, I would say, you know, that if you get an invitation for the vaccine and you're in certainly one of those higher risk groups, such as immunosuppression, you should get the vaccine, and sooner rather than later would be I think the best preference.
All right. Well, then we will keep on going down the line. There are some great questions here. So Tim Strudler says, can you talk about LGH's capacity and how it compares to the expected surge through the rest of January?
So, you know, surge prediction has been tough. It's been difficult since the beginning of the pandemic. There's a lot of factors that go into what's going to happen with cases, but I think on the hospital side, and we're seeing this just in the past couple days, that we're starting to see an uptick again. So we did have a little bit of a peak right around Christmas and New Year's, and I think that was probably an artifact related to the testing that was being done then. We came down in cases, and over the past week and few days, we've seen an uptick. We don't think we're going to see a lot more cases on the hospital side than what we're seeing right now, which is averaging anywhere from 90 to 120. We do have plans in place that can open up beds that we have not been using, and we can open them up pretty quickly. So we do have plans in place for adequate staffing and also providers that can take care of patients in those beds. We think we can handle whatever any potential surge is coming down the pike, at least for the next 3, 4, 5 weeks. And our hope is that we'll start to kind of see a decrease in cases, which eventually will lead to a decrease in hospitalization. So there are active plans in place, and we think we can handle anything in the near future that happens related to COVID.
Awesome. We had kind of skipped one, a point there was, I think, the second half of the question of, in addition to talks like this, are there efforts being made to address the concerns within communities of color or BIPOC, given historical medical abuse that our communities have suffered, and there's understandable mistrust among some communities, and what can we do? You know, the public health piece of things, I think it's very challenging not having a public health department. But I think what we have is a really strong community and a lot of good collaboration. For example, with these town halls that the NAACP is doing, I think are making a great impact. And this collaboration and this conversation needs to be built on to, you know, with the further rollout of the vaccine and information. Churches, it's like, how do you do community work as you work with the community, you know, not for the community. And so I think continuing on this vein is really important, and I'm happy to be a part of that.
All right, we have a question from Harry Knox. He says, is there a website to sign up for the vaccine?
So again, this is one of those things where it's really going to be important to think about your primary care provider or your employer, depending on what you do. That's not having a public health department. How the vaccine is going to roll out is going to depend on where you could get it from and what risk category you're in. So the short answer is no, there's not a website to sign up for getting the vaccine. If you have a primary care provider with Lancaster General, you'll get a message, or being active in My LG Health, you'll get messages through there to say you're based on your code's pre-existing conditions or what's known about you through your care, that like when you're up in the vaccine line. And it's fine to ask. And if you know, hey, I am at increased risk and I want to know when is it my turn, to reach out to your primary care provider. Anything you wanted to add, Jeff, about how?
Sorry about that. I had to have a little bit of food here during the.
Yeah, I think the question was like, is there a website to sign up? But I think the more broad question is, how do you know when you can get it? Because we know you can't, it's not open or available to general public now. How can we follow along, or when will people be notified of vaccine availability for general public?
Yeah, and I think Dr. Hamblin hit the nail on the head. Without having a public health authority, to really direct all the folks that have access to the vaccine and all the folks that need to have priority to getting the vaccine, it's a little bit more challenging and difficult, because there's going to be a wide variety of approaches to get vaccination out into the community, including the health system, including independent providers, including the CVS and the Walgreens, including the county. So there's going to be a variety of efforts. It's a little different in other places that have a stronger public health presence. I just heard that a colleague of mine, her parents could sign up for the vaccine in New Jersey on a website. It would tell them what their risk was and kind of where they would be, and then somebody would reach out to them for that. We don't have that kind of system set up in Lancaster County. That being said, there's actually some benefit of not having a public health department, in that some ways we can be a little more facile and move a little more quickly than if we were kind of held down by some bureaucracy related to a public health department. So we are getting vaccine out. Lancaster County has got the 5th most vaccine in people's arms of any county in Pennsylvania, which is pretty remarkable for our small little county. It would be nice to be able to give everybody very clear instructions of what's going to happen, but it will be a group effort. And the way I see it happening to most folks is either through your email, through social media, through work, through different avenues, that I think we'll be able to get the word out that, okay, this is the group that we're now vaccinating and this is how you get it done.
Something I think about, I feel like a lot of times good things, or they say bad news travels fast. And many times it takes a long time for good things to get to Black people. I'll just say it like that. Don't let the vaccine be one of those things. So I say that to say, if you have a primary care provider, reach out and ask or check what is their schedule. Again, for LGH, it's using My LG Health. There's so many times that I have patients who are not using My LG Health, or their My LG Health is down, or they don't have their internet access. Everyone's using a ton of data right now. And so whatever way you have access, whether it's through your job, whether it's through your doctor's office or your primary care provider, or if you're offered it in another setting, get it, because this is what we've been waiting for. I think everyone is tired of COVID. So without having one central place where that is exclusive to give vaccine, I think it's wherever you can. I feel fortunate to have had the chance to just get it through my employer. I had hesitancy at first. I said, well, I'm used to wearing my mask and I'm used to these patient encounters in this way. And we've been living through this for this long. Let some other people go ahead and get the vaccine so I can see how it goes. 40,000 people were in the trial. 40,000 people went ahead and got it. So if I feel like I do not want to contract this deadly virus. I don't want to lose another friend. I don't want to lose another family member. And now I have the chance to be protected from it and not be worried when I hug and kiss my kids after coming from the office and seeing how many people, even with trying to decrease the number of exposures, at my first opportunity to get it, I waited a few days until I was convinced, with some emotional turmoil. But I think continuing these conversations and having this discussion, addressing the fears and concerns, and then weighing risk of getting COVID and a bad outcome from it versus the risk of having the vaccine with arm soreness. And of course, there are unknown things. There's unknown things also with what I ate for lunch. There's unknown things for any, other exposures that I have that I choose. And so the fear of the unknown in this case, the things that I need to know about the vaccine in order to move forward and feel confident in that it will provide me protection, and that the risks of the vaccine that I understand are less than my risks of getting COVID. That's what pushed me over the edge.
Okay, we have a follow-up question from Tim that says, can you talk about plans to vaccinate hard to reach populations once we reach phase 2?
Well, I think that's a very good question. I think of it the same way we have thought hard about how do we reach hard to reach populations with messages around how do you stay safe for COVID? Why is mask wearing important? Why is social distancing important? Why is hand washing important? And typically, at least I can say from the healthcare side and our team, the way we do this is to reach out to members in the community that understand that community. So, for instance, we were having a lot of issues with the Amish population accepting messages about public health and how to stay safe related to COVID. And actually, at around the same time, we thought there might have been a fairly decent surge in cases in the Amish community. Well, we had contacts. We talked to people in the Amish community. We worked through their safety committee. We asked them what's the best way to message this? What's the best words to use? What are the triggers that get people to understand that it is important to wear a mask? And even if you don't see this thing and you don't have a lot of folks that get it, that get very, very sick, why it's important to try to prevent the spread in your local community. So I think vaccine distribution is going to be the exact same way, depending on whatever community we're reaching out to. It's going to try to partner with them, ask them, what is the issues or ways in which we can intersect and provide information. But I think in general, the most important piece is to listen and understand the reasons why people might not be taking up the vaccine. And I think that's what we intend to do.
Okay. Any follow-up, Dr. Hamblin?
No, he's good. I think.
All right. They keep on firing off here. So next question, does the vaccine work on the new strain of COVID-19?
Yes, it doesn't appear that the new strain, the UK strain, or some of the other strains that have been identified are affected or subvert the vaccine immunity. So right now we think that there's these new strains are not affected or can go around the vaccine. I'd also say that there's been a lot of discussion about the new vaccine, or the new strain being in Dauphin County, the UK strain. We do not have the ability to recognize that strain with the kind of testing that we're doing right now. The State Department of Health has said if someone is identified that has been exposed to the UK strain, then their quarantine should be 14 days and not get the 10 or the 7-day reduction. But right now, we don't really think that we're going to be able to tell a lot of people that you have the UK strain because we can't identify it. And there's only a very few labs in Pennsylvania that will be doing that. But if someone is identified with that strain, the Department of Health has told us that they will reach out directly to that person and their contacts and give them the proper advice they need to get for having that strain. These new strains do seem to be more transmissible, so they're easier to pass to others, but they don't seem to cause more serious COVID illness, which is a good thing.
I think we're all living through, it's like we're living through an experiment, right? Vaccine trials happened. Now we're in this phase 3 with more people having the vaccine. It doesn't make sense to say, well, stop and let's now study this. We're seeing it happen in real time. So probably, 3 or 4 months from now, we'll know more. But definitely the things that we can do to, one, prevent exposure, and then prevent the illness. So basically all of our measures that we've been doing for all of these months with masks, hand washing, avoiding being in contact with people who are outside of our household. And then if we are in contact with people outside of our household, physically maintaining a distance with a mask as a ways to prevent potential exposure. Now with the vaccine, as it becomes available, to get that, we'll see if there's more variants that come. But I think it would make no sense to wait for new trials to come out to then say, well, I want to make sure that it's good against this previous strain and the new strain before I get protected from the strain that we've been fighting for a whole year. So yeah, more to come, but definitely we know what it is effective against.
All right. A question from, let me scroll up here, get their name. A question from Donald Davis. He says, if a person has had COVID, how long will that person be safe and not able to get COVID again?
Yeah, so that's a great question. And the answer is we don't know. As Dr. Hamblin has said, this has been an experiment, and it's been an experiment that we've only had, in the U.S. less than 12 months. So right now, the CDC has said with pretty good assurance that if you get COVID, it's very unlikely that you will get a reinfection within 90 days. And so it's probably longer than that. It's probably quite a bit longer than that. But right now, with the available evidence, most people feel safe saying that within 90 days of having COVID, as long as you have recovered, you're through the isolation period, you no longer have to quarantine or isolate based on any potential COVID illness. So you most likely cannot get reinfected within that 90 days. Now, as time goes on, we'll be able probably to lengthen that time frame out to longer, 4 months, 5 months, 6 months as time goes along. But for right now, it's 90 days.
Another piece to that is just like, if you've had COVID before, should you get the vaccine? So there's evidence that basically you have a better immune response with the vaccine, so if you had COVID before and then are offered vaccine, you still can have a benefit because we don't know how long that immunity lasts for.
All right. Next question from Lauren Gilbert says, have the terrorist events in DC impacted COVID relief and vaccination distribution?
So I think they've affected a lot of things. I don't know that it slowed down things as far as that we were seeing a ripple effect here in this community. But I think in general, like the continuous assault, whether it's from COVID or from the political happenings, I think that we're all wearing pretty thin. But specific to disrupting vaccine distribution, none that I know of.
Okay. Kyle Lau says, would it be okay to just get one dose? How important is it to get both doses of the vaccine? Would you be able to interchange the vaccines? For instance, one dose from Pfizer and get the second dose from Moderna?
So I want to take this, Jeff. Like I said, I'm an OBGYN and I have I think very directly. So for example, when we know that we're on a vaccine schedule, we only know what's studied. So I find it very interesting when you see on social media and through some of our elected officials encouraging, they're saying, look, we need to get as many doses in people's arms as possible. Doesn't matter what it is, speed up the sequence, or give it in a shorter interval or give it in a longer interval. We're trying to convince people based on what we know from the vaccine trials of what was safe and effective, to now change it completely and say, we're just going to go rogue. Forget the schedule, we're just going to try it's kind of like hard to even wrap my head around. So what we know is, they're two different things. They're two different compounds that are given. And so most hospital systems that have been doing vaccine distribution, they have been basically, they've been holding back this second dose. So saying that if I know that I got this 21 days ago and now I need to get the second dose, so I made my appointment for both, I made my appointment for the second dose and they held it there for me so that I could actually get it. And so what is being talked about in the national media and also on social media is perhaps we can get more people vaccinated if we're not holding back that second dose, that we think that the supply is sufficient, that it will be there in the 21 days. So let's get as many people vaccinated and then trust that the supply chain will be there to get the second dose on time. And that's different than saying switching things out or changing the actual vaccination schedule.
All right. Dr. Martin, did you want to add anything?
Well, I would just say I'm kind of torn about that whole idea too. The reason it was proposed was that there was some evidence that a lot of immunity occurred with the first shot. But again, I think that, the way this was studied was with the 2-shot regimen. With the Pfizer vaccine, that's 3 weeks apart. With the Moderna vaccine, it's 4 weeks apart. And I guess, based on how we've done immunizations forever and ever and ever, I think following the original protocol seems to make sense, unless this new protocol is actually studied and looked at so that you can extrapolate it. So, but I may not be the one that's making the decisions, and this may end up being more of a political one. But if the CDC comes out, I generally would trust their guidance.
Yeah, we all want to be out from this. So I think that sense of urgency is definitely felt.
All right. We have a question from Tim. He asked. Oh, I lost it here. He asked. Here we go. I believe the vaccine is free, correct? Whether one is insured or uninsured.
Yes, the vaccine itself is free. There may be a charge related to the administration of the vaccine, similar to kind of what we've seen with the COVID test, where the COVID test itself is free, but to swab somebody or to assess somebody, there might be a charge associated with that, which I don't know if it's being sent to insurances. I think if people have insurance, they'll probably be billed. If people do not have insurance, I'm not sure that we will be going after the billing related to the administration of the vaccine, at least on the healthcare side.
So just to go on that a little more, I think this is one of those things, again, where, we've had messages in the media that say anyone who wants a test can get a test, right? But we have to see, how is that actually? how is that actually working? If you have someone like this, for someone in a community, how do they get tested? And so the real avenue in our area, I think, is through your primary care office, or, if you don't have a primary care, testing, CVS, urgent cares are available there. And so that messaging is important. For the vaccine, how are you going to get the vaccine? And so you have to, now I think is our time to plot and plan, where am I going to get my shot from? And so figuring out who's the closest. Is it better to go through your employer? Is your employer going to get an allocation of vaccine? If not, is it your, where you go to school, or is it your primary care office? And if you don't have a primary care, I would say establishing care with someone now is great, so that you're in the mix, in the know. We want to be first, at the top of the line to have good things available to us, whether it's the 6 points that Blanding talked about at the beginning of this meeting. And so for those who feel, one, want to be protected against COVID and are tired of this entire pandemic, then, and feel confident or comfortable with the vaccine, be first in line for that. If it's more so about making sure that you're connected to a provider, if you're having symptoms and need testing, let's make sure that we're first in line for that. Whether it is, so many things, the paycheck protection, all of these things. It's just, I feel so strongly that so much of time when we're talking to Black people, brown people, communities of color, it's tell us what we need. I don't need nobody to tell me what I need. Give me options and I can help myself. Clear the way. Don't be a roadblock, a stumbling block to me. And I think that message of just, let's be empowering, let's facilitate agency among people, and let's be, and let's be fair, and let's be equitable. That's really what I want to see, and that's what I want to be a part of.
All right, we are wrapping up here our last couple of minutes. So we have here, I believe, 3 more questions, all stemming from Mr. Harry Knox. So our first question are they working on an oral vaccine or one you can inhale?
I don't know of the other vaccines, especially like, the flu mist, which is a nasal vaccine where you squirt it up your nose, or an oral one. So I really can't comment on that. There are other vaccines that are coming down the pike that work a little differently than the messenger RNA vaccines, kind of like how the tetanus vaccine works. So those will be coming out probably in the next few months, but not an oral or a mist one that I know of.
Me either. And Jeff, right before we finish, I have nothing to add about that. I don't know anything about that either. But as far as testing that we currently have, I know we're using a nasal swab. Is there anywhere through LGH that you know of that we're doing testing in a different way?
Well, right now we're not doing a lot of the rapid tests. There are other health systems in the county that are using more of the rapid antigen tests that you can get in your office. Most of the tests that we have, including the rapid test that we're doing in our offices, is the nasal swab. So, and it's the PCR test. So we have dedicated our lab and also the labs that we contracted with to primarily do the PCR nasal swab test. And it doesn't have to be the swab that goes all the way back to the back of your throat. It's the test that just does the front part of your nose. We've decided to kind of maintain going after those kinds of tests because the accuracy is so much higher, and we can make decisions based on the results, but without having to do backup testing. some of the rapid antigen tests that are out there, the saliva test, the accuracy is not as great, and in certain situations, you need to back it up with a PCR swab. So without going into more detail about that, that's kind of where we're at on the healthcare side, at least in Lancaster General.
Yeah, and I just want to piggyback with that. You know, the type of test that you get is going to be determined by where you're getting tested. It's like, what tests do they offer, and what the situation is. For example, when I order a COVID test at Women and Babies, it may be there are various different machines that the test can be run on. I don't determine that. That's determined on the lab in the clinical scenario. And so there's so many things, and I feel like one of the messages I'd like to really get across is, throughout this, no one is asking every patient, every person to become a public health expert or a testing expert. You know, it's more, some of these tests and some of these decisions are made not even by the person ordering the test, it's made by the situation, what's available. There's so many variations that I think it can be wasted energy. There was a question just thrown in there at the end about traveling to the islands. And so I think this is really important. Everyone's tired, but now is not the time to let up. We've been waiting for almost a whole year to have safe and effective treatment and prevention. We now have the vaccine, and it's rolling out so that we can prevent terrible illness and prevent more deaths. The other way of prevention is minimizing our risk, minimizing our contacts with people, and using our mitigating strategies like hand washing, wearing a mask, and minimizing your contact with people outside of your immediate family. Now, how do you travel? It's like, now's not the time for the leisure, you know, kind of for leisure travel. And then, but it also depends on where are you going? Because the end is kind of in sight, but it can be so difficult for how long this is going on. I think people get a little bit, it's like, some things are open. It doesn't mean that because it's open doesn't mean that you should go, but you're going to make an individualized decision. So how do you minimize your risk through whatever decision you're making? If you're traveling in your car, you know, now's not the time to like pile up in the car with people who aren't in your household. You know, if you're going on a hike, that's some time away, and otherwise you would have carpooled to go hiking. Well, ride in your different cars. You can be on a hike and you can be distanced from someone and still enjoy outdoors, which I don't do any of this stuff. So, you know, I don't know how that's working for anybody else, but the way that you do things matters as well. So traveling by air, like to say, take a quick trip because a flight is cheap because airlines are trying to stay in business. You know, I haven't been on a plane. I don't foresee myself being on a plane for several months, if at all, during 2021. And if I were to travel on a plane, I'd be wearing an N95 the whole time and eye protection. If you're gonna go somewhere, if you're going there to be there for some amount of time, a significant amount of time, many islands are actually offering, it's like, well, you can work from here. If you can work from home, you can work from this island. And examine wherever you're gonna go, examine what the protocols are. My family's from Barbados. There's a very strict protocol. You test before you arrive. Before you come, your test must be negative. When you arrive to Barbados, they're gonna test you again, and then you go into quarantine in an approved hotel. You sit your butt in your room, and you can order, and they will bring your food, put it outside of your door. You literally have a tracker. There was a little girl from, I can't remember, was it Alabama or something, who went to the Caribbean and it was clearly premeditated that she knew she wasn't gonna follow the rules, and then she was put in jail. I will tell you, Barbados will put you in jail. You break quarantine, because islands are stuck with what resources are there. Many islands have suffered terrible economic consequences. We think it's bad. If a country is completely reliant, or their number one source of income is tourism, like, it's been bad. And then to open up and have people disrupt and not follow rules, like, you'll have problems. So just check the rules for wherever you are going, and really kind of manage manage your risks with information. And I think we've been in it so far for so long. Now's not the time to get careless or let up.
All right, all right. So we have one more question here before we let you all go. So is testing available without an appointment in our county?
Yeah, so the way testing works, and unfortunately this is what we're handed with not having a public health department in the county, is that every test has to have an order. So a provider has to put an order in for you to get a test. Now, for those that do not have a provider, you can register at the testing site to get the test. And when you go through the testing site, someone will place an order for you based on your symptoms or whether you are an asymptomatic contact. But in general, for most of the testing sites, in order to handle the flow of the people coming through, we do like people to have an appointment or schedule the time slot in order to get get through efficiently. So we did try, some of the mass testing sites, as you recall early on. There was good things and bad things about those mass testing sites. The Department of Health currently has a mass testing site that they opened up yesterday, or actually today, I believe, at the Sears Auto Center. It'll be there until Saturday. And that is a place that you can go without an appointment or without an order because they're using a standing order from one of the public health physicians to order to do the test. So right now for the next 4 days, you can go to that site and get tested if you want. When they leave, we'll be back to the usual mechanism of testing that we have in the county.
So on that, I know the time is up. I feel like there's just so much. On the point about testing, please do not talk yourself out of, is COVID possible? I watched a great friend and colleague give a clinical vignette where, a person, they said, I didn't have a fever. It's like, if you have a fever, okay, if you have loss of sense of taste or smell, and it can be not complete, there's something that's off. Headaches is another significantly a common symptom. And so if you have suspicion, right, it's like the airport. If you see something, say something. If you're like, I don't know, one is stop and think about your contacts or, what's your mechanism that you could possibly contracted COVID. If you haven't been anywhere and you've been in your house, and perhaps this is just, it's not something, and then monitor, watch what happens over the next, few days. Contact your primary care provider if you have concerns. Contact them by phone. Don't roll up on people. I will tell you the number of times that the patient has come in and they have concerns, and we're like, what are we supposed to do now? Or how many more people could have been exposed? So these are conversations that we can have to really decide, is it something where we're concerned to where we think that you need to have testing put in orders, you go to a testing site or be tested at one of our offices, and we will have an answer in a few days. And in that time that we're waiting on results, it's important to not be exposed to anyone else who doesn't live in your house. So all of those things, again, if you have concerns, think about it, pay attention to what symptoms you're having, report them to your care provider, or look for testing. CVS is doing testing. Again, it is by appointment, but you don't have to, if you don't have a primary care, that's another way. And then manage the time between being tested and getting results in a way that shows care and concern for those around you, which means stay at home. Stay at home and don't expose anybody else. Let's get an answer and then move from there.
All right. Dr. Hamblin and Dr. Martin, thank you so much for this amazing, remarkable, insert positive adjective here. This was absolutely amazing. Before we head on out, any lasting words, any call to action nuggets of knowledge that you would like to drop on the audience?
I want to just say, thank you to the NAACP and thank you to TCP Network for this opportunity to share and talk freely about, where we are now in this pandemic and what decisions and what opportunities lie ahead of us. And I hope that we can really just beat this thing back as quickly as possible and not, I agree we are done dying. Now's the time to kind of come together and get this done as far as preventing the further spread and really just kind of eradicating COVID-19. So thank you for this opportunity.
And I want to echo that. Thank you very much. I think this pandemic has exposed many vulnerabilities in our community, not only related to race, but economics, to health equity. And if anything, as we get through this together, we certainly will need to go back and look and see, what are those vulnerabilities and how can we do better as a health system and how can we do better as a community to care for those that are most impacted. To me, that's going to be the lasting legacy of the pandemic. And again, thank you very much for letting us share tonight.
All righty. Well, we will be looking forward to more sessions like this, and for everyone that has joined us on the attendee side, thank you for joining us, and until next time, be safe, wear your mask.